Hi, my name is Tanvir Hussain. I was born and raised in Houston, Texas. That's where I completed my undergraduate education at Rice University and also my medical school at Baylor College of Medicine. I then moved to the East Coast where I completed a residency in internal medicine at Harvard at Brigham and Women's Hospital, and then a fellowship in clinical research at Johns Hopkins Hospital with a focus in cardiovascular disease and cancer care. I'm a general internist, and that allows me the flexibility to practice both as an outpatient primary care provider as well as practice medicine in the hospital as an attending physician where I get to work with residents as well as medical students. I think I like the variety of roles I get to play as a general internist. In the outpatient setting as a primary care provider, I get to focus on keeping patients healthy, at the top of their game, functioning at their best. And when we all suffer from bothersome symptoms, I get to become a detective to try to get to the bottom of what's going on as quickly as possible so that patients don't really need to be too concerned and can move on with their lives. When I'm in the hospital, I get to play a different role, that of what I imagine as sort of a quarterback for the patient, where we often have very ill patients with multiple complex conditions, and I work with a team of specialists, nurses, and other clinicians to make sure that patients receive timely, appropriate, efficient, and effective care so that they can really get back on their feet as quickly as possible. When I first sit with a patient, it's a lot of listening before I come to any conclusions. It's a lot of getting to know what are the values and beliefs and priorities of the patients, and then sitting down and marrying what medically needs to be done with what the patient's preferences are and collaborating to come up with a plan. I'm the first physician in my family, and I've had really the privilege of providing care on 5 different continents. And I think what's really special is that there's something universally sacred in that patient-doctor relationship when someone entrusts you with the care of their health. And I think it is that relationship that brings me to work every day. Throughout my training, the experiences that I've valued have included delivering cutting-edge medicine, embracing the opportunity to take care of complex patients, and training the next generation of physicians. By working here at Nebraska Medicine, I get to continue that journey. I will be able to see a wide spectrum of illnesses from patients across the Midwest region. I'll be able to work with some of the brightest minds of young physicians. And also I'll work alongside leadership who are really visionary, who want to push Nebraska Medicine to deliver even better, high quality, safer, patient-centered care. And these are what drive me to be a physician and make me happy to work here.